Silent heart attacks. Are you at risk? Welcome back. Today we're diving into a crucial health topic that could save your life. We're talking about heart attacks, but not just any heart attack, the silent ones. Did you know that heart attacks can happen without any obvious symptoms? These are called silent heart attacks, and they can be just as dangerous. Stay tuned as we break down 6 often overlooked signs of a silent heart attack. Unusual fatigue. Don't just brush it off. Let's talk about fatigue. We all get tired, right? But there's a difference between everyday fatigue and the kind that could signal a silent heart attack. If you're experiencing unusual fatigue, the kind that's persistent and doesn't go away with rest, it's a major red flag. This is especially concerning if the fatigue comes on suddenly or after physical activity that you could normally handle without a problem. Don't brush it off as just another busy day. If you're experiencing unusual fatigue, especially in conjunction with any other symptoms we discussed today, it's essential to see your doctor. Shortness of breath. When air becomes a luxury. Next up, we're tackling shortness of breath. If you're experiencing shortness of breath without any obvious trigger, especially during rest, it's time to pay attention. This can be a sign that your heart isn't pumping blood effectively and your body isn't getting enough oxygen. So if you find yourself gasping for air after simple activities like walking to the mailbox or doing light chores, don't ignore it. It could be your heart sending you an SOS. Indigestion or nausea, more than just a tummy ache. Let's talk about indigestion and nausea. But what if I told you that those seemingly innocent symptoms could actually be a sign of a silent heart attack? Indigestion and nausea, especially when accompanied by other symptoms on our list, can be a sneaky way your heart cries for help. When a heart attack strikes, blood flow to the heart is restricted. This can disrupt the digestive process, leading to feelings of indigestion, nausea, and even vomiting. Pay close attention to your body and any other symptoms you might be experiencing. Discomfort in the chest, back, or arms. Listen to your body's whispers. We're moving on to a symptom that's a bit more familiar when it comes to heart attacks. Discomfort in the chest, back, or arms. But here's the catch with silent heart attacks. The discomfort might not be as intense as the classic crushing chest pain you see in the movies. It might feel like a dull ache, pressure, tightness, or even a burning sensation. Sometimes they whisper, and it's up to us to listen. So if you're experiencing any unusual discomfort, don't hesitate to get it checked out. Dizziness or lightheadedness. When the room starts spinning. Let's talk about dizziness and lightheadedness. When your heart isn't pumping blood effectively, it can disrupt the flow of oxygen-rich blood to your brain. This can lead to feelings of dizziness, lightheadedness, and even fainting. If you're experiencing these symptoms suddenly, frequently, or in conjunction with other symptoms on our list, it's important to seek medical attention. Your brain relies on a constant supply of oxygen-rich blood, and any disruption can have serious consequences. Sweating. When your body breaks out in a cold sweat. Last but not least, let's talk about sweating, specifically cold sweats. Breaking out in a cold sweat without any obvious reason can be a red flag for a silent heart attack. When a heart attack strikes, your body releases adrenaline, a hormone that triggers a cascade of physiological responses, including sweating. If you experience a cold sweat along with any other symptoms on our list, especially chest pain, shortness of breath, or nausea, it's crucial to seek medical attention immediately. Don't wait to see if it passes. Outro: stay informed, stay safe. So, there you have it, 6 signs of a silent heart attack you should never ignore. Sometimes they whisper, and it's our job to listen to our bodies and recognize the warning signs. Early detection and treatment can make all the difference. Stay healthy and stay informed.